Reprieve Behavioral Health is an intensive outpatient program, an outpatient program that grew out of the need of expanding mental health services in New Jersey. We've been established now providing substance use services through Reprieve Recovery. And at this point, we're expanding to make sure that people with mental health conditions and disorders are getting the care that they need and deserve throughout the state.
We really wanted to grow our services and make sure that we were filling the gap that is here in the state of New Jersey. There are really not a lot of mental health programs, and we wanted to be able to step in because we know there's so many people that are in need here.
There's also a unique opportunity, right, with substance use clients in particular to step down to address mental health concerns. So after completing an intensive outpatient program for co-occurring issues, being able to continue that work within the same center could really help a lot of people throughout the state. And we don't really use a diagnosis as a driver of treatment, right? It's all about improving the quality of someone's life and helping them to function in the community in the best way that they can.
And I think we find that a lot of times people that need that level of care, the intensive outpatient level of care, are people that maybe they were in outpatient services or, stepping down from substance use treatment and finding that they have some more mental health symptoms that they didn't realize they needed to address. But sometimes people are also coming from, maybe they were in individual therapy with someone for a while, and then they started to have more escalating symptoms and just needed a little bit more treatment to really get stabilized in their lives. And we're able to offer that in our intensive outpatient program. We can start people at a 5-day-a-week program, which can be really helpful. People can continue to work while they're in our treatment, but also are able to live their lives outside of treatment. This is not the only thing in their life, but it also is a chance for them to really increase their support and focus on their mental health.
So when we're thinking about a mental health problem, we're not just thinking about that disorder or that diagnosis. We're thinking about all the areas that impacts, right? Financial wellness, our emotional health, physical health, really looking at that problem as how it impacts all of those areas so that we can help somebody to move forward, to find things that work for them. I think we could both say we've seen plenty of people who they come in with similar problems, but the way that they get through that is so individual. And that's what this is all about. It's about finding the thing that works for each client that comes through the doors at Reprieve.